Okay, hi guys, Dr. Termechi here. We are, actually, let me get my mic set up first. I just want to show you an interesting case where we're going to probably do the surgery on Thursday. So I find this very interesting to take a look, so I want to share it with you. We have, in the past, we have done a joint type of online kind of tutorial on a basic of CT scan and treatment planning. Today, that's not it. I just found an interesting case that I want to share with you, so you could look at it. I already treatment planned the case. It's done, but I want to show you this case. But in the future, we'll go to the next stage of doing more of these tutorials that you can always go back and do it. And you could go onto my YouTube channel, Dental Implant Surgical Seminar, and subscribe there, because a lot of these, if you end up not watching it live, we kind of convert it and we'll put it there. The first tutorial was the basic of CT scanning and treatment planning, which we didn't really get into the treatment planning portion of it, but how to look, what to look in the CT scan, and to be able to use a simulated program like a Blue Sky Bio program, which is a free program that anybody can download and use. So that's basically what I use in my own office, and it takes care of all my needs as far as creating a surgical guide. If you want to be a little bit more fancy, you can do ortho with it. If you want to be a little bit more, you can also do digital dentures and so on and so forth. So you have a lot of, oh, there's no voice. Hang on a second. There's no voice. Can you hear me now? Give me a thumb up if you can hear me. No? Voice? No voice? Hello, hello? Okay, let me just take this off. Now it's good. Excellent. Thank you. I appreciate it. Okay. I guess there was no voice from the beginning, so the purpose of this tutorial basically is I just want to show you a case that, thank you, I appreciate for pointing that out, because I could have been talking and not realizing that there's no voice. Anyway, the point of this tutorial is for me to just, I have an interesting case that I want to show you. It's a little bit more advanced, but we have had tutorials where we show a basic of CT scan and how to read basically a CT scan more than anything else. That was the first tutorial. If you want to watch that tutorial, you can go on our YouTube channel and subscribe, Dental Implant Surgical Seminar, and you could subscribe to our YouTube channel where I post some of my cases there and surgeries and so on and so forth. Interesting stuff. So, but the reason I'm doing this tutorial is I just found a new case. It's an interesting case. We probably will do the surgery. But what I want to show you is how we are going to actually send the case to a print job and print it out. So without any further ado, I'm going to switch the camera now to show the computer and the case. And if you have any questions, you can certainly go ahead and ask me, but I want to just run you through this case, okay? So let's do this together. So here we are. So here is our case. And I'm going to go through each window and I'm going to maximize it. But the first thing we should look is a panoramic view. So here's our panoramic view. The treatment plan for this particular patient is to basically extract all her teeth. Patient is not interested to do any sort of sinus lift. So we are bound to basically do a maybe 5 or 6 implants and give her a fixed screw retain upper prosthetic. But we need to do this at the same time. This way we can save some time for the patient. So the patient does not need to do this in 2 stages. So she basically wants to get this done in one-time deal. Now, we're going to do a guided surgery in this particular case. So I'm looking at this and I'm becoming more and more under the assumption that when you're looking at the case like this, there are few teeth that are still in good shape. The canines are doing okay, but that's the only 2 teeth that I can probably say safely that this patient can probably retain over the next 5 years. So now the question is, if you're doing dental implants and now at this point you have sinuses in your way, so therefore there's no implants you could place back here unless you perform a sinus lift in these areas, okay? So if that's the case, then what advantage do we have by holding on to the canines? Because now it's going to break your prostheses. Probably very best to take them out as well. I hate to take out good teeth, but at times I just kind of say, you know what, probably for the best. Economically is for the best for the patient, and the long term is the best for the patient. So therefore, I suggest that it's probably for the best to do this as a unit. In one case, just uninstall all the teeth and reinstall the implants. So now, the treatment plan that I made for this patient, now here is the 3D image of this case. Now, the white area that you're looking at, the white area is the CT scan. The yellow is our stitch from the STL file. So if I go to the surfaces and I get rid of the yellow, so here's your CT scan, and I guess you know, has to do with the density of the bone in this particular area, okay? Now you could see a nice large defect in this area where number 4 is, okay? And we need to just pay attention to that area, okay? But otherwise, everything else is kind of maintained. So I put the STL file and I get rid of the CT scan, okay? Now, what I did over here in this particular case is that I held on to a couple of teeth where I'm not placing where the implants are, okay? And I digitally remove the other teeth in on the maxilla. So therefore, I have few stops for my guide. I'm gonna put the guide up so you could see it, but I held on to a couple of teeth in this area, okay? And then, so this way, these are some stops, plus other things and other methods that I try to do here in order for me to keep the guide stable. So if I can, oh, now the computer is saving, hang on. If you have any questions, please don't hesitate to ask while we are doing this. But so now let's go first to my treatment plan, and let's see if you agree with my treatment plan. The treatment plan is here's my treatment plan, okay? Implant number 5, 6, 8, 11, and 12. So we have 5 implants that are going in. Now, when you're looking at a panoramic view and you say to yourself, you know what, these implants are not so in line with each other, okay? The reality is that they are, and the panoramic view is not a great view on the Blue Sky Bio for you to determine that, okay? But also place 2 implants over here, which is number 1 and 2, which are basically acting as a fixation pin. So therefore, now, this area where I'm not placing an implant number 4, I'm holding on to that tooth number 4, to support my guide. Tooth number 9 to also support my guide. And plus, I have 2 fixation pins that I'm using in order for me to hold on to the guide. So we pretty much are going to be in good shape as far as holding on to this guide. So 5 implant on top. Let's just put okay, and so now here is the treatment plan. Let's take a look at it in the 3D. Okay, pretty much it's coming from the lingual area, so I'm happy about what it looks like. Okay, it's hard to see because the abutment is the same color as the cast. Okay, so we got 5 implants. Now, if you want to take a look at the parallelism, this would be a good place to see. You could see 5 and 6, 8, and you could see 11, 12, okay? Sometimes in order to get everything nice and parallel together, you're gonna end up with extreme angulation mesiodistally from the implants. So therefore, you have to pay attention to that, which is not a bad thing, but at least when it comes down to restoration, it will make it a lot easier to try to restore this. Let's quickly take a look at each implant, okay? So here are number 5, okay? And let's, okay, of course we're going backwards. Let's go forward. So this is implant number 5, implant number 6, implant number 8. Click on 8 just to take a look. Here you are. Okay. Oh, sorry, apologize. And keep on going, keep on going to number 10. Here's number 11. I just click on it. Okay, to number 11 is 4-3 by 13. And number 12 is 3-5 by 11.5. So, anyhow, but that's done. And now we're going to go to surfaces. I made a guide, so I'm just going to put up the guide. I'm going to put the guide tubes as well, just for us to take a look. So here is our guide, okay? It's going to be a fully keyless guide. So something I like to show you where I prefer much better is this. Take a look at my fixation pin, okay? Something that most people do not do this, and they rely on a fixation pin cylinder. I don't like the fixation pin cylinder. It's another thing I need to worry about, whether that fixation pin is actually glued well or not glued well, and then it gets loose in the middle. I had bad experience with it. Maybe you had good experience with it, but for me, it didn't really work so well. So what I do here is that I make my fixation pin to 2 millimeter in width, and I make my hole for the fixation pin much longer, so I have more guide, and then I shrink it down to a 2.1 millimeter. So this way I have a space to put the pin through that hole, but not too big in order for, and then I check it before, once it prints out, I check it to see if my pin goes through well. And if it's not, I have a 2 millimeter burr that I basically use for my implants, and I put it in inside to get a good fixation pin. So I use the acrylic to basically hold my fixation pin and not and not the cylinder, metal cylinders to hold them inside. So that's something that I would do it a little bit different than this. But here is the guide. The guide is done. So now, once the guide is done, you can go and export the guide. And I just want to show you where we are. I'm trying to find the patient now. Wrong folder. So after the case was exported, here is our guide. Unfortunately, I cannot make it any. I can actually make it larger as a full screen. So now you could see we have 2 teeth that's going to hold the guide, plus I have 2 fixation pins, and you could see that this is slightly smaller than what the regular fixation pin comes in automatic on a Blue Sky Bio. I like to shrink it, and I like to maximize the length of this pin so it gives me a nice guide through as I'm making my osteotomy for a fixation pin. So that's basically it. I just thought that I share this with you of how we get there and how we're gonna do it. Please join me later on. I will probably post it on my Facebook account and as well as the Instagram account. Just don't forget, we do run a course that's called Dental Implant Surgical Seminar, short for DISS. In Guatemala, you place 25 implants. After you are done, you learn how to do this kind of work, how to make a guide in your own practice, how to print them in your own practice, how to place the surgery, do the surgery, and perform all these things. So this is what we teach. So therefore, I like to go ahead and just give you a little snippet of what we do in Guatemala for 4 days. And if you're interested, please go to our website, Dental Implant Surgical Seminar, and pre-register. But I will have more videos later on, probably with in conjunction with a laboratory that sponsors us, which is a New Parts Dental Lab. You know, on their account as well as my own account, we'll have these kind of tutorials of how to do different things on the program. Okay, I hope you enjoyed this. Please like the video. Please share the video if you liked it, and also subscribe to our YouTube channel, as well as if you're interested to learn about dental implant surgery and sinus lift. You can certainly go ahead and sign up to our course in Dental Implant Surgical Seminar, DISS, and come in, and we'll love to have you. Thank you very much. I got to go see a patient. Take care.